I worked for 2 chiropractors for almost a year to make sure I wanted to come to chiropractic school. And one day they took me to lunch with all these other chiropractors, and I went around the table going, where did you go to school and where would you go if you had to do it over again? And they went to various schools, but each and every one of those 8 chiropractors said we would go to National if we had it to do over, and I was so impressed with that. So I came to National and I never regretted it. I'm very science oriented, very research oriented, and I love that about National. Our learning at National was heavily based on diagnosis, and a lot of other schools go, nope, you just need to do the spine. And I'm not knocking that, but I am so grateful that we spent so much time doing mock patient setups and patient cases. They even hired patients with real conditions to come in and act like they were coming for the first time and let us be the doctor and try to figure out what was going on. I have to do that constantly. I have a completely unusual practice. It's 100% an autism biomedical practice. And I got dragged into that kicking and screaming because I became an autism parent. When I first found out that my child had a form of autism, we were told there is no treatment and take him home and love him. Well, guess what? We're in the middle of a global epidemic of autism spectrum disorders. 50,000 young people a year are turning 18 with autism spectrum disorder. We call it the silent tsunami. What is so wonderful is that the research in the 18 years since my child was born has been fabulous. It can be devastating when a family gets the news that a child has autism, and although they're all different, up to 3 out of 4 of them have a central gastrointestinal issue, which creates most of the problems I dealt with in my home, at least. And instead of medicating for that, they need to find a doctor who will investigate and pursue the fact that it could be related to the GI tract. I think anyone reading anything in the media today has caught on that there is a central gastrointestinal issue with most of these patients, not all. And that would be the very first thing I would investigate. Each of the modalities I use at my practice is targeted at underlying physiologic imperfections or body cycles that are affected. We use special diets. We heavily rely on very special enzymes, not just to support digestion, but to achieve certain processes in the body. We use hyperbaric oxygen therapy. We do a lot of work with antioxidants and anti-inflammatories. That GI tract is primary in my practice. So a lot of the work I do is supporting the GI tract, and of course that's where the bulk of the immune system is located. You wouldn't believe the function that we can recover. Sometimes we don't say cure with autism, but we call it losing the diagnosis. When you calm an aggressive child with autism, it helps the family heal, it helps the school function better, it helps the community, it helps the world. I have patients coming from 10 states. I have a 4 to 6 month waiting list at my practice. Talking with your patients and working with the whole patient and figuring out the problem and how to get their life back to balance, getting your hands on people and feeling that healing that you can help develop in people. It's just, chiropractic is a great profession, and I have never regretted it once.